Dr. Francis here, and today we are going to talk about the treatment of infertility. Before we get going, if you're enjoying these videos and would like to see more videos on women's health care, please hit that subscribe button. Now let's get back to talking about infertility treatment. Infertility treatment depends on several factors, including 1, the cause of the infertility, 2, how long you've been infertile, 3, your age and your partner's age. Number 4, personal preferences. And unfortunately, some cases of infertility just can't be corrected. If pregnancy doesn't happen after a year of unprotected sex, couples often can still become pregnant through infertility treatments called assisted reproductive technology. But treatment can involve big financial, physical, emotional, and time commitments. First, let's talk about treatment for men. Men's treatment for general sexual problems or a lack of healthy sperm may include lifestyle changes. Your healthcare team may recommend that you take the following steps. 1, have more sex often and closer to the time of ovulation. 2, get regular exercise. 3, drink less alcohol or give up harmful substances such as tobacco. Number 4, stop taking medications that can affect fertility, but only if your doctor tells you to do so. The second option is medicines. Your team may prescribe medicines to improve sperm count and boost the chances of a successful pregnancy. These prescription drugs may help the testicles function better too. The next thing is surgery. Sometimes surgery may be able to reverse a sperm blockage and restore fertility. In other cases, repairing a large varicocele may improve the overall chances for pregnancy. Sperm retrieval procedures. These techniques can collect sperm if you can't ejaculate or if no sperm is in your semen. Sperm retrieval procedures also may be used when assisted reproductive techniques are planned and sperm counts are low or irregular. Now let's focus on treatment for women. Some women need only 1 or 2 treatments to improve fertility. Others may need a few types of therapies to become pregnant. Fertility medications are the main treatments for infertility due to ovulation trouble. They can help the ovaries release an egg if ovulation is irregular or stops happening. Talk to your doctor about your options. Ask about the benefits and risk of each type of fertility medication. The next thing is intrauterine insemination or IUI. With IUI, healthy sperm are placed directly into the uterus around the time that the ovary releases 1 or more eggs to be fertilized. Depending on the reasons for infertility, IUI can be timed with your menstrual cycle or with the use of fertility medications. Your partner or a donor provides the sperm. The next thing is surgery to restore fertility. Some conditions of the uterus can be treated with hysteroscopy. These include polyps, scar tissue, or some fibroids. Laparoscopic surgery with small cuts or a traditional surgery with a large cut in the stomach area may be needed to treat conditions such as endometriosis, pelvic adhesions, and larger fibroids. Assisted reproductive technology is any fertility treatment in which the egg and the sperm are handled. In vitro fertilization, or IVF, is the most common type of assisted reproductive technology technique. Some of the key steps in a cycle of IVF include fertility medications. These are used to help the ovaries make eggs. Mature eggs are then removed from the ovaries. The eggs are fertilized with sperm in a dish in a lab. And then the fertilized eggs, also called embryos, are placed in the uterus. Embryos that aren't placed in the uterus can also be frozen for future use. Sometimes other techniques are used in an IVF cycle, such as intracytoplasmic sperm injection. In this, a single healthy sperm is injected directly into a mature egg. Often, this is called ICSI, is used when semen quality or quantity is poor, or it might be used if fertilization attempts during prior IVF cycles didn't work. Assisted hatching is a technique that helps an embryo attach to the lining of the uterus. It opens part of the outer covering of the embryo, which is why it is called hatching. Donor eggs or sperm. Often assisted reproductive technology is done using a couple's own eggs and sperm, but you have the choice to use eggs or sperm from a donor. This is an option if you're single or in a same-sex relationship. It's also done for medical reasons, and these include poor egg quality due to age and sperm problems such as a blockage in the reproductive tract. Donor eggs or sperm also might be used if one partner has a genetic disease that can be passed on to the baby. An infertile couple can use donated embryos too. These come from other couples who received infertility treatment and had leftover embryos that were frozen. Gestational carrier. People who don't have a working uterus or for whom pregnancy poses a serious health risk might choose IVF using a gestational carrier. In this case, the couple's embryo is placed in the uterus of a person who agrees to carry the pregnancy. Genetic testing. Embryos made with IVF can be tested for genetic problems. This is called pre-implantation genetic testing. Embryos that don't seem to have a gene problem can then be placed in the uterus. This lowers the risk of a parent passing on a genetic condition to a child. Complications of infertility treatments may include 1. Multiple pregnancies. The most common complication of infertility treatment is a multiple pregnancy, such as twins, triplets, or more. A higher number of unborn babies in the womb raises the risk of premature labor and delivery. It also makes problems during pregnancy more likely, such as gestational diabetes or hypertension. Babies born too early face worse odds of health and developmental challenges. Ask your doctor about all the risk of multiple pregnancy before you start treatment. Ovarian hyperstimulation is another risk. Fertility medications can cause this condition in which the ovaries become swollen and painful. The risk of ovarian hyperstimulation goes up with the use of assisted reproductive technologies, such as in vitro fertilizations. Symptoms of this can include mild pain in the stomach area, bloating, and upset stomach that lasts about a week. Nausea may last longer if you become pregnant. Rarely, a more serious form of ovarian hyperstimulation causes rapid weight gain and shortness of breath. This is an emergency that needs to be treated in a hospital. Another risk is bleeding or infection. Assisted reproductive technology or reproductive surgery comes with the risk of bleeding or infection. As you can see, there are many treatments for infertility. And after a thorough evaluation to find your cause of infertility, your treatment plan can be specifically tailored to you. If you have suffered from infertility and would like to share your story, please leave a comment below.